1. A resident with dementia becomes agitated during a bath. The CNA should A. Increase the water temperature. B. Continue the bath quickly. C. Calmly talk to the resident and try again later. D. Leave the resident alone for an hour. 2. Which of the following is the best way to prevent pressure ulcers? A. Keep residents warm. B. Reposition residents regularly. C. Apply lotion once a day. D. Increase dietary sugar intake. 3. A CNA notices a resident with a new bruise on their arm. The CNA should A. Ask the resident who did it. B. Document it and ignore it. C. Report it to the nurse immediately. D. Put a bandage on it. 4. The term ADLs refers to A. Advanced disease limitations. B. Activities of daily living. C. Additional dietary logs. D. Active daily lift. 5. What is the correct way to measure a resident's output? A. Weigh the resident daily. B. Record the amount of food eaten. C. Measure the fluids excreted in milliliters. D. Count how many times the resident urinates. 6. When communicating with a hearing-impaired resident, the CNA should A. Speak loudly while turning away. B. Use short, simple sentences and face the resident. C. Shout to make sure they hear. D. Turn off the lights to reduce distractions. 7. Which of the following is a sign of dehydration? A. Clear urine. B. Dry mouth and lips. C. Excessive sweating. D. Sudden weight gain. 8. A resident begins choking while eating. The CNA should A. Give the resident water. B. Pat the resident on the back. C. Perform the Heimlich maneuver. D. Call the family. 9. Hand hygiene is most important. A. Before and after breaks. B. Before entering the building. C. Before and after resident contact. D. At the end of the shift. 10. A residence care plan states NPO. This means A. No pain observed. B. Nothing by mouth. C. Nurse provides observation. D. Normal physical output. 11. When transferring a resident from bed to wheelchair, the CNA should A. Use a gait belt. B. Lift the resident alone. C. Roll the wheelchair away. D. Avoid communicating with the resident. 12. Which of the following is part of standard precautions? A. Wearing gloves for all contact. B. Using a mask for all procedures. C. Hand washing after contact with bodily fluids. D. Sterilizing all linens. 13. A resident who is on bed rest complains of pain in the calf. The CNA should A. Rub the leg gently. B. Notify the nurse immediately. C. Apply a heating pad. D. Encourage the resident to walk. 14. Which of the following is a sign of elder abuse? A. Improved mood. B. Unexplained bruises. C. Regular family visits. D. Healthy appearance. 15. If a resident refuses care, the CNA should A. Force the care. B. Report the refusal to the nurse. C. Ignore the resident. D. Tell the resident they must comply. 16. Proper body mechanics include A. Bending at the waist. B. Keeping feet close together. C. Lifting with your legs. D. Twisting while lifting. 17. A partial bed bath includes washing the A. Legs, arms, and back only. B. Face, hands, underarms, and perineal area. C. Entire body. D. Hair and nails. 18. When feeding a resident with dysphagia, the CNA should A. Offer liquids only. B. Use a straw. C. Feed slowly and check for swallowing. D. Give food in large bites. 19. The first sign of a pressure ulcer is A. Open wound. B. Blister. C. Redness that does not go away. D. Drainage. 20. The proper temperature range for a resident's room is A. 60 to 65 degrees Fahrenheit. B. 85 to 90 degrees Fahrenheit. C. 68 to 74 degrees Fahrenheit. D. 72 to 80 degrees Fahrenheit. 21. What is the first thing a CNA should do when finding an unresponsive resident? A. Start CPR. B. Call the family. C. Report to the nurse immediately. D. Attempt to move the resident. 22. When making an occupied bed, the CNA should A. Leave the bed rails down. B. Ask the resident to stand. C. Keep the resident covered. D. Remove all pillows. 23. Which device helps prevent foot drop? A. Crutches. B. Footboard. C. Gait belt. D. Walker. 24. Which is a responsibility of the CNA during admission of a new resident? A. Diagnose medical conditions. B. Complete the physician's assessment. C. Assist with orientation to the room. D. Administer medications. 25. Which of the following is a restraint alternative? A. Tight sheets. B. Bed alarms. C. Hand mitts. D. Wheelchair belts. 26. When a resident is in restraints, the CNA must A. Check the resident every 4 hours. B. Leave restraints on continuously. C. Monitor the resident's condition frequently. D. Avoid repositioning the resident. 27. A CNA observes a resident eating their meal with difficulty. The CNA should A. Report to the nurse. B. Remove the tray. C. Tell the resident to hurry. D. Take a picture for documentation. 28. A resident's weight is best measured. A. After meals. B. At bedtime. C. At the same time each day. D. After a walk. 29. The The purpose of reality orientation is to A. Confuse the resident. B. Remind the resident where they are. C. Encourage fantasy. D. Ignore memory loss. 30. What should the CNA do if a resident is found lying on the floor? A. Help them back to bed immediately. B. Call 911 without checking anything. C. Stay with the resident and call the nurse. D. Scold them for falling. 31. A resident begins to cry while talking about their family. The CNA should A. Change the subject. B. Tell the resident to stop crying. C. Listen quietly and offer comfort. D. Walk away to give privacy. 32. Which of the following is the best way to ensure resident dignity during care? A. Speak to other staff while providing care. B. Close the curtain and explain procedures. C. Rush through the bath. D. Ignore the resident's preferences. 33. What should a CNA do before starting any care procedure? A. Check the schedule. B. Read the chart silently. C. Identify the resident and explain the procedure. D. Wait for a family member. 34. A resident is having trouble sleeping. The CNA should A. Give the resident sleeping medication. B. Encourage relaxing bedtime routines. C. Turn on bright lights. D. Provide a heavy meal. 35. A CNA accidentally spills a cleaning chemical. What is the first action? A. Leave it and report later. B. Cover it with a towel. C. Refer to the safety data sheet or SDS. D. Wash it down a drain. 36. Which of the following is an example of subjective data? A. Resident has a temperature of 101 degrees Fahrenheit. B. Resident complains of pain. C. Resident has a bruise. D. Resident's food intake is 50%. 37. A CNA overhears a coworker speaking harshly to a resident. The CNA should A. Ignore the situation. B. Confront the coworker later. C. Report it to the nurse immediately. D. Tell another CNA. 38. The main goal of hospice care is to A. Cure the illness. B. Provide comfort and support. C. Prolong life at all costs. D. Prevent death. 39. What is the best action when a resident with Alzheimer's is wandering? A. Lock all the doors. B. Use physical restraints. C. Redirect the resident gently. D. Yell to get their attention. 40. A CNA is assigned to care for a resident with MRSA. What PPE is most important? A. Sunglasses. B. Mask only. C. Gloves and gown. D. Earplugs. 40. A CNA is assigned to care for a resident with MRSA. What PPE is most important? A. Sunglasses. B. Mask only. C. Gloves and gown. D. Earplugs. 41. To help prevent falls, the CNA should A. Keep bed in lowest position. B. Leave spills on the floor. C. Keep lights off. D. Remove call bell. 42. A resident requests to see their medical chart. The CNA should A. Show them the chart. B. Refuse politely. C. Refer the request to the nurse. D. Make a copy for them. 43. What should the CNA do if a resident is having a seizure? A. Put something in the mouth. B. Hold them down. C. Move objects away and call the nurse. D. Leave the room immediately. 44. Which of the following is considered an output? A. Water drunk. B. Soup eaten. C. Urine voided. D. Ice cream consumed. 45. When assisting a resident to walk with a cane, the CNA should A. Stay behind them. B. Hold the cane for them. C. Stay on their weak side. D. Stand in front of them. 46. The best way to prevent infection is A. Using hand sanitizer occasionally. B. Wearing gloves all day. C. Hand washing frequently. D. Avoiding sick coworkers. 47. A resident becomes combative during care. The CNA should A. Shout for help. B. Step back and remain calm. C. Restrain them immediately. D. Leave without finishing care. 48. When should a CNA chart a resident's care? A. Before providing it. B. After completing it. C. At the end of the shift. D. The next day. 49. If a resident refuses to eat, the CNA should A. Tell them they must eat. B. Report it to the nurse. C. Remove their tray immediately. D. Ignore the refusal. 50. How often should a dependent resident be repositioned? A. Every 6 hours. B. Every 4 hours. C. Every 2 hours. D. Once a day. CNA long-term care. The CNA long-term care certification test is designed to assess the knowledge and skills required for certified nursing assistants who provide care in long-term care settings such as nursing homes, assisted living facilities, and rehabilitation centers. The exam evaluates a candidate's ability to assist residents with daily living activities, maintain safety and hygiene, report changes in condition, and support residents' emotional and physical well-being. Topics include infection control, communication, residents' rights, personal care, and restorative services. This certification ensures that CNAs are competent to meet the unique and ongoing needs of elderly and chronically ill residents, promoting dignity, independence, and quality of life in a long-term care environment. Here are the top 5 beneficial uses of CNA long-term care exam. 1. Employment qualification. This certification is often required to work legally as a CNA in long-term care settings like nursing homes and rehabilitation facilities. It proves you meet federal and state standards. 2. Improved patient care skills. Preparing for the test helps CNAs develop critical skills in hygiene, safety, and communication, leading to better resident care. 3. Career advancement. Certified CNAs are more likely to be considered for promotions, specialty roles, or advanced training opportunities such as medication aid or LPN programs. 4. Higher job security. Certified CNAs are in greater demand and enjoy more job stability, especially in aging populations where long-term care needs are growing. 5. Professional credibility. The certification enhances a CNA's professional reputation, showing employers and families that they are trained, competent, and committed to quality care.